Congressman John Shadegg, Republican from Arizona, continues to join us. And Congressman Dennis Kucinich said he makes this decision not as the bill that he would like to see it, but as it is. What is your reaction?
Well, I think you just asked me about whether or not it was appropriate to say that the Speaker or the President were breaking arms. I think you just heard Dennis Kucinich, who's a very thoughtful and serious member, acknowledge that this is not the bill he wants, that it will not help the cause he believes in, but having flown to his home state with the President, spent that time on Air Force One, listened to the President extol him at his district, he's decided to vote for the bill. Yeah, I think people are being put under intense pressure. And when you say their arms are being broken, I think you could ask Dennis Kucinich. Was his
arms are not broken? What he did, and he didn't talk about that. But Congressman, what he said, he said this is a historic fight. He said this is aware of a historic fight.
Which is exactly what I was saying.
Right, but his view of history is that he needs to help move the process forward, even if he's not sure it will get him closer to his causes.
That's the point I'm making. Leadership, this is not a decision he reached on his own. He did not come to this microphone today having reflected on it overnight without having gone on Air Force One with the President. My point is, the point I made before and the point I'm making now, just been illustrated by him. He's under intense pressure, and that's all I am saying, and I think he just acknowledged that in his remarks.
What about his position, though, Congressman, that if it were up to him, we would take away the for-profit aspect of health care, that we should not be making a profit off of people who get sick, that the government should be treating health care like it treats a lot of other things in this country and not essentially rewarding corporations for making a profit off of people's sickness?
Here's exactly what I think about that. Here's exactly what I think about that. The reality is this bill is going to reward for-profit companies that have done a disservice. This bill mandates, with the IRS executing the penalty if you don't go along, that you and I buy health insurance plans from for-profit companies. That's an outrage. It's the same for-profit healthcare companies that have done a lousy job of taking care of us, and yet this bill gives them exactly what they wanted. The insurance industry, the for-profit insurance industry, wanted an individual mandate, and that's what they're getting out of this bill. The for-profit insurance industry did not want a public option because they don't like competition, and guess what? They're getting that. This bill is giving to the for-profit insurance companies, and I happen to believe that Dennis is making this point, it's giving the for-profit insurance companies exactly what they want. They already don't compete for our business.
You and your party support the for-profit insurance companies. You support the for-profit insurance system.
You know, you guys keep saying that, but I'm not the guy pushing the bill that says we should compel people to buy insurance from the for-profit insurance guys. That's the Democrats, that's the President bill, that's the Speaker's bill. It's their bill that says
so you support single payer?
I would support
a government-run Medicare system. Let's just be absolutely clear for all of our viewers. You support a government-run Medicare expansion. Is that right?
I would support forcing American healthcare companies to compete. Right now, they have a monopoly. They don't have to advertise to me. They don't have to sell to me. They don't even try to sell to me. You turn on the TV tonight, you will see 10 advertisements by auto insurance companies trying to sell me auto insurance. You will not see one advertisement by health insurance companies trying to sell me health insurance because I can't buy it, because the tax code says if I buy it, I have to buy it with after-tax dollars. That makes it impossible. It is immoral in this society to say that if you get health care from your employer, it's tax-free, but if you want to go out and buy it yourself, you work for a lawn mowing company in Arizona in my district, and you want to buy your own health insurance, you got to buy it with after-tax dollars, and this bill doesn't fix that. This bill says to that poor lawn man, you must buy health insurance or your government is going to fine you, and you must buy it from the same for-profit companies that are not doing a very good job of holding down costs right now. And your bill, the Democrats' bill, forces people to buy that insurance from those for-profit companies.
It's not my bill, but I think even Republicans agree that if you're going to take away things, listen, Congressman, let me finish. You and I and everybody agrees that the insurance companies should not be able to exclude Americans based on pre-existing conditions, right?
Absolutely.
Okay. Well, the way to do that without causing premiums to rise is you have to increase the risk pool somehow, right?
That's what you believe. I actually believe.
Every economist believes it, Congressman.
Let me explain what I've done on that issue, because I've already passed legislation on that issue. I passed a bill that says every single state can create a high-risk pool. You put all of the sick people in that high-risk pool, but you pay for their care from the premiums of the people who are healthy. I wrote that bill. I passed that bill. It was signed into law. Now, 33 states have done it. That is a way to take care of people with pre-existing conditions or people who are sick, spreading their cost amongst the healthy or amongst the taxpayers. And the reason that we're willing to do that is because none of us knows, you don't know and I don't know, that we might not be in that high-risk category tomorrow.
Right, but how we get those people who are healthy, how you get them to start paying insurance premiums instead of paying no premiums and saying they don't want health insurance, that's an ongoing debate. But Congressman, look, you underscore that there are some serious intellectual discussions that we need to have about how we do this, and we appreciate you coming on this morning and joining us today. Congressman John Shadegg, Republican from Arizona. Congressman, thank you.